Thank you, my lady. So, Gavin, I want to move on, if I may, to another topic, which is that of the school closures in January 2021.
Of course.
And I wanted to start with your statement at page 84, paragraph 1029, please, and if that could be brought up on screen.
Yes.
Thank you. If that could be enlarged, please. In that paragraph, you set out that you remain of the view that school closures as part of the third...
Yes, no, please, yeah, sorry.
And I should say, Sir Gavin, before I put this, I'm simply asking, I'm not asking you to explain all of this now. We'll go through it in detail. I simply want to ascertain that you stand by this. So you set out paragraph 1029, that you remain of the view that the second set of school closures as part of the third national lockdown was a mistake and that the government should have kept schools and colleges open fully to all pupils. Do you stand by that?
Yes.
You also set out it felt like the government was taking all possible measures, including schools, partly just to get people's attention and alert them to the seriousness of the situation. Do you remain of that view and stand by that?
Very firmly.
And you say, I thought the decision was taken to close schools to the majority of pupils, not because this would have a significant impact on the infection rate, but more because the government had to be seen to be using all possible options available to them to turn things around, correct?
That's what was said. And yes, that's my view.
That's your view. And you then go on to say, I recollect the then CDL, I think that's Sir Michael Gove.
That's correct.
I think comparing it to smashing a Ming vase on the floor to get people's attention. Yes?
Yes.
And then you go on to say, I think as I say above, the government should have given the mass testing regime that we had put in place, as well as all the other closures announced as part of the third lockdown, a chance to work. It should only have closed schools when all other options had been exhausted, correct?
Yes.
So you were putting the mass testing regime that you had implemented to the fore of the reasons why schools shouldn't have been closed, correct?
No, it was one element because there was a whole set of other measures that whenever schools were open, that there were controls and restrictions and constraints in place to limit the spread of COVID. So it wouldn't have been just mass testing, but that would have been an element, but it would have been an additional element over and above anything else that we had done previously.
And how important did you regard the testing in schools, the regime that you had implemented, as part of the rationale as to why schools should stay open in January 2021?
So, as Secretary of State for Education, I wasn't sat there thinking, I want to do an enormous exercise in mass testing. In fact, the largest single testing coronavirus testing, certainly in this country, that had ever been done, probably one of the largest ones in the world, for the sake of doing that. The only reason I was doing it was because I was of the understanding that by doing it, I would then have the ability to open schools. So I was doing it as a means to keep schools open and to get schools open after Christmas, because that's what I was led to understand was one of the criteria that originally the Department for Health and Social Care put a high value on, a number 10, and they thought it was one of those control mechanisms. So that's why I set about trying to deliver that.
All right, we're going to come and look at that in a bit of detail, but before we do, I just want to check as well that you stand by what you said at paragraph 12.8 of your statement at page 98, and you're referring here to the decision to close schools. And you set out, firstly, we had seen the impact, especially on the most disadvantaged children, of not having schools open and operating as normally as possible. My concern was that the second set of restrictions would set back children's educational recovery and progress even further, correct?
Yes.
Secondly, I felt it was wholly unnecessary We had seen exceptionally high rates of COVID-19 in a number of northern towns and cities, yet had been able to keep schools open in these areas over this period. Whilst this would be exceptionally challenging at a national level, I felt it was the right thing to do, as keeping children in school was so beneficial to them. Yes?
Yes.
And you go on to say, I still believe that the decision did not sufficiently take children's interests or well-being into account. Yes?
Correct.
Do you stand by that?
Yes.
And you go on to say, I believe that the decision to close schools in January 2021 was not required. It was a panicked decision made without having children's interests front and centre.
Yes,
That's a very, sorry, forgive me, that's a grave allegation to make against those who took the decision.
Well, I think when you hear phrases like closing schools is smashing a Ming vase on the floor to get people's attention, I think it shows a lack of seriousness of actually not putting children first. As I mentioned earlier, we'd seen an enormous impact on children in that first lockdown. We'd been able to avoid children being sent home and schools closed in the second lockdown. And I felt duty-bound to do everything that I could do to keep schools open and fight that corner for children and what I firmly believe was the right thing to do.
And that lack of seriousness in not putting children first, you've mentioned Sir Michael Gove and what he said. Were there others who demonstrated this lack of seriousness in your view?
I feel that the decision was made to close schools, and I understand, and maybe it's sometimes easier being just in charge of a department as against being in charge of a whole government or having a much greater cross-government sort of reach. But, I could understand their concerns, especially about the new variant of the virus and the spread of it. But I felt that it was as much done for messaging and it was trying to influence and change behaviour, because the closure of schools on the first lockdown had been quite an important part in terms of changing the patterns of behaviour. So I felt that they were reaching that for that lever because they felt it was the easiest lever to reach for. This is why every time another obstacle was put in our way to say, oh, you can only open schools if you do this or you do that, I was so determined that we tried to do everything that we could do, and even if it meant having to make some compromises that we weren't comfortable with, because I just didn't think it was justified. And I appreciate there are some children that were vulnerable to COVID, but there was a good understanding of who those children were, and COVID wasn't going to be having the impact in terms of children's health that it was maybe first feared, and I felt that it was really important to get them back in for January after they'd had so much disruption.
So can I just, coming back to my question as to who this was a lack of seriousness on the part of, so Gavin, is that a lack of seriousness on the part of the Prime Minister?
Well, I think maybe actually I think they chose to prioritise different things, which is ultimately a choice a Prime Minister has to make. He has to prioritise one set of needs, and I think he chose the NHS over children, obviously as the Minister, the Secretary of State, ultimately for children in many ways, in all ways. You want to be the one who's fighting the corner for children. And so ultimately the decision was disappointing. and it was probably more so because we thought we had won the argument. I actually personally felt the Prime Minister, every instinct of him wanted to see children remain in school. I'm certain he did, because I remember speaking to him on the morning of the 4th, and he was, like me, sort of urging me on, saying, you've got to get all the children into school, you've got to get them there, you've got to get them into the lessons, get the schools open and everything else. I mean, he was on television that morning saying exactly the same thing. So I believe that he was there, but I believe emotionally and in his head that's what he wanted to do, but he was persuaded otherwise by others, and I imagine that would be probably Matt Hancock and Michael Gove and Chris Whitty and Patrick Vallance, who will equally have a different set of a different competing agenda. And of course, always the easiest thing to do is to shut things. But I felt that the consequences for children wasn't properly taken into account. And we'll probably end up moving back into this, but you can sort of see over all those weeks there was a pretty ferocious debate and discussion through government, as quite simply I tried to do everything I could do to persuade and keep the position that schools would be opening, even though we had to make compromises in terms of delaying secondary schools, and we were having to put restrictions in London, none of which we ultimately wanted to do, but all of which were compromises we're trying to do to keep the principle of the bulk of schools opening. But I thought that was a debate we had won. I thought it was an argument we had won, to the point that we were actually opening, and then everything changed.
Well, maybe we can take this in stages.
Of course.
Let me just try and understand, or to see if we are starting from the same premise. So, Gavin, one of the concerns was, as I understand the documents, that there needed to be a testing regime in schools if they were to stand a chance of reopening, because transmission rates were going up.
That's right.
In the winter of 2020, correct?
Correct.
And if we pick up, please, the chronology at INQ 000546731. This is a document of the 4th of December. And if we go, please, to paragraph 9. It explains, doesn't it, that serial testing could keep close contacts of cases in schools, can keep close, so contacts of cases in school, and reduce COVID-related non-attendance. It refers to you as proposing a targeted approach to rollout in schools and colleges next term, including prioritising asymptomatic and serial testing for teachers in secondary schools and serial testing for pupils in exam years. Yes?
Yes.
So I just want to be clear about this. You understood that testing could play an important part in keeping schools open, and we're working towards that end, yes?
Yes, and we'd been running trials, I think it was a couple of months beforehand on this. At the time, the supply of lateral flow tests were obviously much more limited, but we had started trialling this in schools, partly to drive out COVID from schools, but also to try and make sure that children were able to, if they'd been in contact with someone, that they're able to keep attending schools and being able to test them and make sure that they...
So we've moved on.
Yes.
There have been those pilots.
Indeed.
Paragraph 9 at the end says, your task force, because this is addressed to the Prime Minister, is supportive of this proposal, although Department for Education does not yet have robust delivery plans or clarity on any funding support schools will need. And Do you accept? I don't. Simply that was the position at the 4th of December, that
yes,
those plans
that was
needed to
clear.
be. And if we move on, please, I think it's right that you made an announcement on the 15th of December that secondary schools would have access to rapid testing. Yes?
Yes, correct.
And that people would be eligible for testing if they were a close contact of anyone who had tested positive. I think I said people,
Yes.
but pupils. So this was testing for close contacts, correct?
Yes, correct.
And staff also as well,
That's
yes?
correct, yes.
Can you help me? As of the 15th of December, who was it envisaged would be carrying out testing in schools?
So the initial discussions were, and this was through conversations I had had with my officials, and as work had been started in probably early December, moving through, the initial vision and our initial understanding had been that the Test and Trace organisation would be one of the key deliverers of testing in schools. This was obviously the organisation that had been set up with quite a substantial budget in order to do testing on a mass scale. And then there seemed to be quite a sudden retreat. So that sort of understanding, and as we've been drafting a paper, suddenly seemed to crumble quite rapidly in a short space of time. And the emphasis shifted from test and trace, delivering testing en masse in schools, to schools delivering testing en masse within schools, which was requiring a complete different sort of set of thinking, because we'd almost all we had to do to start with was provide the setting and the pupils, and then we had to sort of very rapidly move to a place of actually what does it look like, effectively an education workforce plus.
Can I, forgive me, I
course.
don't wish to cut across you, but I
Yes.
think we can probably demonstrate so that we have clarity
Yes,
about
of course.
this, given how important it is. If we go to INQ 00075503, please, and that's page 1. And again, just so that we can see, this is a document of the 15th of December.
Yeah.
It's a document from your department.
Yeah.
It does say, and Department of Health and Social Care, although I don't think we need to go into the dispute as to whether it's a joint document. I think it's suggested that it's a document from you. I don't think it matters. It's really just to establish what it says.
Indeed.
So I think, Sir Gavin, at paragraph 3, it was setting out, so we'd heard your base proposal, which this document sets out.
Yeah.
There was then a further proposal
Yeah.
that I think is, again, that there would be testing at the start of term. So a sort of one-off testing event, and then the base proposal would continue testing of close contacts. Yes. And if we go, please, to paragraph 21 on page 9. This is where we understand the logistics involved, that required the mobilisation of a workforce of 49,000 people by the 4th of January. So you had a couple of weeks to come up with a workforce of this size, correct? And it sets out that one of the options was the deployment of military personnel.
That's correct.
Yeah. And I think if we go over the page, I think it suggests that there were reasons why that might not be practical. And in fact, it ends by saying this would need to be directed by COVID-0 and is not a sustainable option. Yes. And then suggestions of other people like firefighters to come into schools to do the testing. So that was the position as it stood on the 15th of December.
Yes.
Someone had to come up with this workforce that was going to do testing. I think if we go to another document, which I think sheds further light on this, INQ 0000911143, please. I think that this document sets out in further detail the fact that testing would need to be delivered by an external workforce. And perhaps if I take this in stages, Sir Gavin, so that I don't mislead you, the second paragraph down suggests that there would be a delay to the start of school, correct? So that the testing could be implemented. Then if we look at the next paragraph down, I think it refers there to the Secretary of State having strong views on the policy. By strong views, was that disagreement?
I think that could be disagreement, yes.
And then I think importantly this, from a Department for Education perspective, testing would need to be delivered by a workforce external to schools and colleges.
Yes.
For the reason that is set out here, that teachers needed to teach, not be involved in trying to test children. And was that because testing children is actually, or running a testing centre is not as straightforward?
So just a little bit of context around this, because if we'd just gone a few days beforehand, the idea that we would have to deliver testing in order to bring children back in January wasn't something that we had really been socialised with. It was something that we were hoping to roll out and deliver as an extra protection. And actually, the biggest part of it was actually about trying to keep children in school more so they weren't having to isolate if they'd come into contact with people. And then in a very small space of time, and I assume with the rise of the new variant and some of the challenges that had presented, then it became a demand as part of a condition of children to be able to come back to school. And, you know, we'd also, the discussion I had with my policy officials was their expectation was that Test and Trace, as I say, the organisation to do testing, would be delivering it on the ground. And I remember coming out of this meeting here with a distinctly different view that where the challenge was going to actually fall and the responsibility on the delivery of the whole sort of testing regime wouldn't end up being something that was quite so shared and more led by Test and Trace. The testing regime would be led, delivered by DFE with the support of Test and Trace and maybe other people.
So if we look at the paragraph below this one, please.
Yes.
Continuing, the Secretary of State for Education said, and we can see set out there, more work was required to develop proposals around delivering the tests. For context, over 10 million tests would need to be delivered within 10 days, and the DFE did not have the expertise to deliver mass testing on this scale. So is that what you're just referring to? That's why you were expecting to have external assistance. And if we go over the page, please. I think the Permanent Secretary then said, this is the second paragraph, that in the process of agreeing the proposal it had become clear that different workforces suggested to deliver testing would fall short of the required amount, correct?
Yes, that's correct.
And then it sets out various points that had been made in discussion. A, deliverability was a major concern.
Yes.
B, the plans thus far hadn't involved primary schools.
No, there's no inclusion of primary schools as part of the testing.
And D, the outstanding issue was around who would deliver the testing. And then E, the potential for military forces, yes?
Yes.
But the point being made that they were already mobilised, I think, delivering vaccine programme and testing in Tier 3 areas. And then over the page, please, and to the bottom of page 3. Low level of, this is you, forgive me, I'm going through this quickly, Sir Gavin, not a proposal which DFE wanted to bring forward. There was a low level of confidence in delivery. Testing on this scale would not be feasible without those with experience of how to do it, and the proposal would not be deliverable if reliant entirely on the school workforce. And I think the suggestion had been made it was like testing in care homes, but you said that wasn't the case. And then over the page, please. We see responding, thank you, that an embryonic but feasible proposition could involve a third of the workforce being provided by the military, yes, or by firefighters again. Yes. So do we take it from this, Sir Gavin, that on the, where are we now, 16th of December, that insofar as there was a requirement or an expectation that testing would be delivered in schools for them to open, that there remained no clarity as to who was going to provide the workforce so that that could be achieved?
I think this may surprise you, but it's occurred a little bit in COVID, where there is the dawning realisation that, if you want to keep, do something, it is going to end up being yourself that has to sort of do it. I think you can probably see from the comments made by the Permanent Secretary, Susan Ackland-Hood, and myself, we were still at that stage, even though it was being indicated to us that it was going to be expected to have testing for children to come back, that there would be a lot of support in order to be able to deliver that. I think after that meeting, not exactly sure of the chronology, but I'm pretty sure after that meeting, Susan and I realised that this was going to be something that we're almost going to have to deliver ourselves if we're wanting to open schools.
Can I just, to conclude this bit of the chronology, go to INQ 00009 1117, please. This is the it is INQ 00009 1117. This is the COVID-0 meeting of the 29th of December.
Yes.
So, Gavin, I won't go through all of this, but if I could go, please, to page 4. And we can see at the start the Prime Minister said that the meeting was to decide whether to delay the return of schools or universities further, given the rapid spread of the new variant. So I think by this stage, Sir Gavin, the situation had become even more severe and serious. And at the second paragraph, it says, the Secretary of State for Education said that he had an exceptionally high level of confidence that the government could deliver the necessary testing in all secondary schools. Just help us with what had changed from the meeting that we just saw, where you were saying that there wasn't confidence that this could be delivered, and why there had been this seemingly quite rapid turnaround, so that testing was now something that you had an exceptionally high level of confidence in.
The reason was that is because we had from that moment when it became clear that the only way that we were going to be able to have schools open was if we were going to be able to stand up that testing regime. We had thrown everything we possibly could do in terms of being able to sort of get matters stood up in order to be able to return children. and have them tested. With secondary schools, we'd also made the decision, which I don't think we sort of touched on, that instead of between the 4th and the 11th of January, that we'd be asking schools to do secondary schools to do remote education. We wanted them to have that full week in order to be able to sort of do everything they could do to stand up testing. We were closely monitoring where the dispatch of tests were going to be and whether they were hitting the many thousands of education settings that they would be needing to do. And we felt, down to the incredible dedication of teachers, military personnel, support staff, parents, volunteers, we felt in a much, much more confident place that we were going to be able to deliver that testing regime. And I think the evidence actually sort of, even though we didn't have a full return of schools as we had hoped on the 11th, still in that week you had tens of thousands of tests being delivered across educational establishments, because you still had many hundreds of thousands of children going into school that week, because attendance rates were much higher because of vulnerable children, children of critical workers and everything else. But also, fundamentally, when the scheme, most schools had got it all set up, it was all ready. Obviously, then they had the delay of schools. But then when the scheme had to start working, when we got all children back, we saw some of the highest rates and highest returns of data anywhere in the world in terms of testing that hadn't been done. And this hadn't been done by the £22 billion test and trace organisation that was focused on doing testing. It was done by amazing teachers, amazing head teachers, amazing volunteers, amazing civil servants, all working to create a mass testing scheme to test millions of people. And we got that set up. And, I appreciate it. There was a lot of worry about it. But the reality was it worked. And it was an amazing, we had to ask people to give up their Christmases and everything else like that to get it set up. But I still think it was the reason we were doing it, because the price of actually getting children to be able to be in school, to get children back into education after Christmas and have that continuity there and to be with their friends and to be able to continue to learn, especially those ones who are most vulnerable, it was worth it.
Can I just, sorry, forgive me if I haven't understood, when you refer to having a testing regime, I think I haven't checked the transcript, so forgive me if I have this wrong, capable of testing millions of children. When, obviously millions of children, children didn't go back to school.
No, but
in January.
But when they did go back, the whole testing regime, which we'd set up over that sort of Christmas period,
they didn't go back to school until starting from the 8th of March.
You're right, but the testing regime had been set up over that Christmas period. And indeed, if you look at the figures, you'll see that even though the testing regime, the testing scheme was already being used in all schools, because of course schools were still open to vulnerable children, children of critical workers. I think if you look at the statistics in terms of school attendance, in the month of January and February, they were significantly higher, in fact raising to around sort of about 35% percentage wise, actually, in the sort of second educational lockdown, much higher in some areas. So the system was working all the way through there, because children were having to be tested, because if they were going into school, that testing regime was there. They were doing the testing, they're going through, they're going to having the benefit of doing that.
Can I go to INQ 00027 3901, please, page 342. This is a Valence notebook entry, Sir Gavin, so the same caveats apply. This is on the 4th of January. 8 a.m. meeting with subgroup chairs, lots of gloom about situation, schools are a mess. COVID PM, new restrictions have been cobbled together, looks like back to March. PM says it's going to knock my India trip on the head. And I think really just skipping down to this, DFE has been proved comprehensively wrong in every judgment over the past week. I mean, I think what that's suggesting and the general point that may be made about all of this was that the Department for Education had massively underestimated the scale of the threat that existed at the end of December and didn't have an adequate testing regime in place. And even if there was an adequate testing regime in place, it could never have met the threat that the virus then.
So we did have a testing regime in place, and that's what we'd worked to do. And you can see as I say, the week commencing the 11th of January, you see tens of thousands of COVID tests being carried out on children that were still going into school. It was there. As to whether it was there to meet the threat, well, what you're then asking is, it's basically an epidemiological question, and my interest was to get children into school and give them the best opportunity, which I felt was for them to be able to have an education in a classroom. And there'll be lots of people who disagree with me on that, and there'll be lots of people who agree with me on that one. But, we were right to want children to be able to go to school. I think the decision was wrong. Patrick Valence is perfectly welcome to have his view, but I think his judgment was wrong to make sure that children weren't able to have an education. And I think the Department for Health were looking purely at their own interests and not for wider interests of children. And it's easier to shut something. And you saw it in the language. You saw it, the Ming Vars, you saw it in the comments of, those who just wanted to minimise contact. And schools, in their view, were a tool of being able to do that. And we did everything we could do. And it was the right thing to do to try and get children back to school.
Lastly, really just this, Sir Gavin, if we could go to INQ 000624 542, page 23, please. It's a message that you sent to the Prime Minister in February that perhaps captures your anger. Prime Minister, I always like to be polite in our conversations, but I must confess to feeling a little hacked off. Not only do I get completely fucked over by decisions on the 4th of January that I took the shit and abuse for, I then get my legs cut from under me by an appointment that you don't have the proper courtesy to discuss with me and get screwed over again. And the rest of that is about the appointment of Sir Kevin Collins. In terms of taking the abuse and getting your legs, well, let's leave getting your legs cut from under you, but what abuse did you take for the decision on the 4th of January, and what, again?
So what was clear, you had a sort of a number of times, if you take free school meals, where we'd given quite clear advice that we should continue to give free school meals through the holidays. You could see how that was the right thing to do by children from disadvantaged backgrounds, and you could also see the obvious political pitfalls that would occur as a result of not taking that advice. But despite all the advice, Number 10 and Treasury felt that they knew better, and we ended up in the reverse situation. on the 4th of January, I fundamentally so strongly believed it was the wrong decision of the government not to have all children back in schools. And in terms of, and what obviously people do tend to view is they tend to see, I would often get the question as to, Gavin, why did you decide to close schools as you opened them? And it always sort of made me smile a little bit with the idea that I had the luxury of a person being able to take the decision. And it can sometimes be frustrating that where you think you have a sort of a position that's landed on the 4th of January, to the point where you're speaking to the Prime Minister's saying it, you've got children back. I think 85% of all eligible primary schools on the first cuts of data had all opened, and we delivered on it, and we thought we'd done the testing regime. For then suddenly by lunchtime to get a phone call to say everything has changed. It can sometimes be a little bit frustrating.
Yeah. The inquiry has, as one of its strands of work, Every Story Matters. Sorry, thank you, that can come down. And many people have contributed to it, and some of the things that have been contributed might be regarded as universal experiences of parents or families during the lockdown. And one says this: whereas my elder two had already grasped the basics of reading, writing, cursive and all of that, by the time we were in lockdown, my youngest, who was just starting out, seemed to have missed the most important months of his education because the school was closed just as he had begun. And you'll, I'm sure, understand, Sir Gavin, that experience of children missing the most important parts of their childhood lives is applicable to almost all children who weren't able to go to school, and indeed those children who were able to go to school. I'm sure you accept that.
And when you were listening and when you've read some of those stories, when you were seeing it with your own eyes, where you were seeing the impact, especially as people emerged from, after they'd emerged from lockdown to come out again, it made you understand how important it was that if we could have avoided that child or any child having yet more disruption, you know, it was really important to do everything we could do to try and make sure that they didn't have that again. And that's why I remember reading Matt Hancock's texts, which were ended up being published in a national newspaper and such like. And you know, I remember when I went into that meeting on the 28th, 29th, having to argue so forcefully to keep schools open because you could see what they were sort of wanting to do, but it was right to try and keep them open because the impact on the children, I didn't believe that actually, I didn't think that most of the people around that table were thinking about what children had gone through the previous few months, and it was a procedure, it was a mechanism in order to deliver their other aims. So that's why, you know, maybe people have been a bit sneering of me about how passionate I was to try and actually make that argument, but I think it was so important to make it because that child's story was a common story. It was in the same story in Wales, Scotland, Northern Ireland, and every part of England. And so trying to make sure that schools returned, and if we had to do superhuman efforts, and so many people worked so incredibly hard to do it, let's do it. And I must confess, I thought I had won the argument to a point where, you know, children were going back, but events overtook.
Thank you. My lady, I think that's all of the time that's been allocated to me, and I think there are questions from our core participants.
There are. Ms Hannett, I think you're going first. Ms Hannett's there. So, Gavin, I only allow a certain amount of time to the advocates who are about to ask you questions, and as you've heard, Ms Dobbin, if you could keep your answers as short as possible and focus on the questions as asked, I'd be really grateful, as I'm sure Ms Hannett.
Yes, my lady.
Thank you, my lady. So, Gavin, I appear on behalf of Long COVID Kids and Long COVID Kids Scotland. Following a meeting in July 2021 between the Department of Health and Social Care and the Department for Education, DfE officials agreed to start drafting operational guidance on long COVID with the aim of publishing it to coincide with schools returning in September 2021. By the 13th of August of 2021, the position had changed such that DfE was saying it proposed to issue some information to schools through informal routes rather than publishing operational guidance. Why did DfE downgrade its position from issuing operational guidance on long COVID?
I believe that would have probably been on the advice that we were receiving from maybe Department for Health and Social Care. That was my understanding. Would probably be more guided by others.
It's right, isn't it, that the safety and the attainment of children in schools was your responsibility, and you had advice in May 2021 that significant numbers of children had developed long COVID. Wasn't it essential to give guidance and support to schools and teachers so they knew how to support pupils who had long COVID and what to do in terms of supporting their educational attainment?
Yeah, and what we wanted to do is obviously we are not a Department for Health or a Department for Education, and you're reliant on others to be able to give you the best advice and the best information as is possible. We aim to get further information out in terms of the September, which obviously some of that did come out, but obviously not as much detail as others would have liked. But it was certainly something that we were aiming to address. And I think if you think back to May 2021, this was a relatively newly emerging sort of issue that we'd become aware of. And, you know, by the actions that we took, we were trying to take that seriously. I obviously ceased to be Education Secretary from the sort of the September 2021 period. So I'm not sure as to what the sort of timelines, but I know that it was work that we had commissioned, we were wanting to address, and we're very much wanting to help and look after children and support schools in supporting children as well.
So, Gavin, in fact, no guidance on long COVID for schools was ever issued, informal or otherwise. And do you agree that it was important in summer 2021 and since that schools and teachers have proper information on what was a new paediatric disease in order to help children in the appropriate way?
It's also important for it to be the right information and correct information. I think it would be even more damaging if something was rushed and it was incorrect and it was inaccurate and it either caused people, to be misled on it. So I think accuracy is probably in this area as important, if not more important, than speed.
So, Gavin, do you recall being told in May 2021 about the existence of long COVID, first of all? So you could have told teachers that it existed, couldn't you, in May 2021?
And to your second point.
Well, can you answer the first point? I'll come to the second.
Oh, I was just assuming. I was just trying for time. Yes, we had a meeting to discuss it, yes.
Right. So you could also have, the fact that they knew that it existed, you could have given them some guidance as to how to deal with children in summer of 2021 who presented with long COVID.
But you've got to have the right information, and as you all know, in May 2021, we were trying to be quite early leaning into this in terms of looking at this, but it's also trying to get the right information so that can be properly shared. I can't sort of speak, obviously, for my successors, but by the fact that we were sort of meeting to sort of discuss this and to raise this shows the seriousness in which we're sort of taking it. But again, trying to have the right information.
My lady, thank you.
Thank you, Ms Hannett. Mr Twomey, he's over that way.
Oh, thank you ever so
behind the
much.
pillar.
Thank you.
Thank you. With my lady's permission, Sir Gavin, a question on behalf of Article 39, if I may. There was a cross-government commitment first made in 2010 and reiterated in 2018 to give due consideration to the UN Convention on the Rights of the Child when making legislation or policy affecting children. Now, what systems and processes were in place within the department to implement, firstly, your general statutory duty to promote the well-being of children, and secondly, to what extent did consideration of the UNCRC influence those systems and procedures?
It's very important and a very serious duty that you see at the heart of your job. I mean, in some ways, the discussion that we're having before you asked your question about why did we go to such extraordinary lengths in order to try and deliver what was required for children to go to schools, because we saw that of critical importance to the well-being of children and their ability to get a face-to-face education. But you would always see it in terms of submissions and what was brought forward to you as Secretary of State about how the child was at the centre of what we were doing and what we wanted to do. And, I had a brilliant children's minister in terms of Vicky Ford, and before that, Michelle Donnellan and Kemi Badnock in the department, who were equally passionate in supporting me and the department in what we did.
But systems and processes?
The systems and processes is like, you would look at where, when you were having to make a decision would always be very much focused around the child, putting in terms of, impact assessments and everything else like that. The day-to-day work of the department very much had, my recollection of it, was very much the child at the heart every single day.
Thank you. Thank you, my lady.
Thank you, Mr Twomey. Mr Broach is right in front of Mr Twomey.
Thank you.
My lady, thank you. Sir Gavin, I have a question for you, please, on behalf of the children's rights organisations. We heard your stark concerns earlier about the lack of consideration for the impact on children of the decision to close schools in January 2021. In more general terms, with no cabinet minister with overall responsibility for children, and with the Department for Education missing from key meetings, to what extent were children and young people's rights and needs prioritised in decision-making at the heart of government during the pandemic, in your view?
I think much of the time it was very much, most of the time it was at the heart. I know I viewed my responsibility to try and battle for those who, those who would not have a voice around the cabinet table in terms of a child. Obviously, not every meeting you were in, and as has been, I've readily admitted, the decisions on the 4th of January, these weren't decisions that I was in the meeting to be, that sort of reversed the initial decision to open schools. So I would say going forward for any future pandemic planning, you absolutely do have to have the Education Secretary. If you are going to make the decision to close schools, you need to have the Education Secretary there to be part of that and do everything they can do to continue to argue for that point. So I'd say most of the time it was good, but there were some times that there were failures.
Thank you. With regard to, for example, other wider issues such as social distancing measures and their application to children, did you feel that you were able to influence the decisions that were being made at the heart of government in that regard from the perspective of children's rights and interests?
We certainly push, but we were always one voice among many voices as well. So you would have different secretaries of state obviously pursuing different agendas. I remember a discussion around play equipment where there'd been bans on play equipment and trying to advocate and speak on behalf of children on this and many other such issues.
Thank you. Thank you, Minister.
Thank you, Mr. Birch. Mr. Jacobs. Mr. Jacobs represents the TUC. Mr. Gavin, you may want to know.
Oh, thank you.
Sir Gavin, good afternoon.
My favourite organisation.
In your statement at its conclusion, you turn to lessons learned.
Indeed.
And your reflection at 12.16 is the government should have a clearly established framework for considering school closures. This framework should set out to the sector the steps that would be taken in the run-up to closures, including thresholds for each step. This would help the education and early years sector better prepare for such an eventuality. It would also be easier to work in partnership with the sector to operationalise such a shift. Do you stand by that reflection?
Yes.
The reason I ask is because, as we have seen, it is precisely the opposite of what happened in the COVID pandemic, and it's a position that you defended today because in August 2020, the decision was that contingency plans would not be shared with schools. Is the reason you offer the lesson learned that contingency planning does need to be shared with schools because actually you recognise, on sensible reflection, that the approach in COVID was wrong?
Yeah, I think that what we saw during COVID, I think if we had had in the years before we even thought we had to move to a pandemic, we'd had a whole set of operational manuals that people would able to understand and have a grasp of, and where some of the movement and tolerances would be. I think that...
Sir Gavin, I'm sorry, I'm going to interrupt because I'm not asking you about January, February, March 2020. Your own paper in August 2020 to the COVID-S meeting says we need contingency plans. Here are the contingency plans that we suggest sharing with schools, and the decision was do not share it with schools. So it's got nothing to do with whether it's possible to have contingency plannings. It had everything to do with keeping the sector in the dark. That was wrong, wasn't it?
It wasn't about keeping the sector in the dark. It was about keeping... there were certain trade unions, such as the NEU, that were working very proactively to sort of ensure that schools wouldn't reopen, and were acting in a way which I thought was highly detrimental to children. And the way that they acted and the way they operated...
So Gavin, let's be fair to the NEU and talk less in generalities and more what they're actually saying. Could we have on screen INQ 000192233? So this is an NEU press release of the 23rd of August 2020. So it's about 2 weeks after the COVID-S meeting has decided we need contingency plans, but we mustn't share them with schools, okay? Top of the second page, if we look at 2 paragraphs, the NEU agrees with the Chief Medical Officer about the benefits a return to full-time education will have for children and young people's education and well-being. We believe that it is vital that the government must take every step it can, both to allow this wider reopening and to keep the R rate below 1. And then if we look at the last 2 paragraphs on that page, schools and colleges, the paragraph above, schools and colleges are currently doing all they can to ensure their buildings are as COVID secure as possible, as well as dealing with the fallout from the exams fiasco. However, school staff, parents and pupils are being sorely let down by government because of a lack of a plan B and of ensuring robust track and trace and test is in place throughout the country. Then if we look over the page at the top paragraph, schools and colleges need to know what should happen if an outbreak of the virus occurs in individual schools or more widely with either national, regional or local spikes. Government advice needs to cover the possible self-isolation of bubbles and, in extremis, moving to rotas or to more limited opening. It needs to cover advice to heads about the protections needed for staff in high-risk categories. So, Sir Gavin, 23rd of August, NEU aren't saying don't open schools in a couple of weeks' time. They are saying we need a plan B. In private, you agreed with them, didn't you?
It's not for me to comment really, actually, what the NEU were thinking. What was provided to schools was information of if there were outbreaks, whether there's local spikes and such like.
Sir Gavin,
sorry, I'm sorry. Are you wanting to ask a question?
I'm just wanting the questions
just ask
answered,
questions or get an
Not
answer?
both at the same time.
Oh, sorry.
Right, repeat the question and see if you can answer it
Very
where
briefly.
you want to.
Let me approach it in a slightly different way, my lady, if I may. This, Sir Gavin, what I would suggest caricature of the NEU being militant and wanting teachers to do anything but teach. Does it really say nothing about the NEU, but lift the lid on the mindset of a government that had lost the wood for the trees and was more interested in fighting with the profession than coming up with sensible plans?
I'm not sure if you've got another question or you'd like me to answer. Do you know, I have immense amount of respect, and especially with, for trade unions, and people who I often disagreed with mightily during the pandemic, such as Patrick Roach, Jeff Barton, Paul Whitehouse. We had many discussions, sometimes disagreements, and I could see how incredibly hard that they were working and how difficult and frustrating that they found the whole situation was. And I have no doubt that we'd sometimes disagree on areas of policy, and sometimes I would let them down in what I could deliver, and they would not go to where I would wish them to deliver. And, that was the type of relationship that we had. The NEU, frankly, I just found was a blocker. And they just didn't want to sort of see it. And there was different unions have different approaches, but that was my experience. And I appreciate we're going to probably disagree on this, aren't we? Maybe if we move on to another question where we can bring more light.
Well, on the subject of trying to bring light, if we stand back and look sensibly at what happened in schools in the pandemic and consider some of the issues around mass testing being announced on the 17th of December to be brought in on the 4th of January, or local authorities wanting to close schools due to regional issues and being threatened with legal action, or opening schools on the 4th of January only to close them that day, is the root cause not this fundamental problem of not having an agreed contingency framework agreed with the sector?
I think that what we work through all the way through is I try to make as much of my time available, and every week met unions and different stakeholders to talk through the issues. I tried and think it was the right thing to do to work with them as closely as possible, even if we couldn't always agree. Some of the very good advice and very excellent guidance came from some of those leaders of unions who were as passionate about education as I was, and the teachers and head teachers and teaching support staff were as well. But we weren't always going to be able to agree on everything, and I do accept that.
Sir Gavin, I'm going to try and deal with one other topic in my final minute. Decisions on the 4th of January. You've described your view that the NHS would not be overwhelmed and it was unnecessary. did you and your department really grapple with the epidemiological advice that SAGE had been giving? And what was it about that advice that you considered to be wrong, such that restricting attendance or closing schools wasn't necessary?
I think you rather sort of betray your natural interest to see sort of schools not delivering education. My natural interest, my whole focus was to actually do what I thought was right for children. And my firm belief now, as it was then, is that the best interests of children were to be able to have education in a classroom with their amazing teachers. I know that the outcomes...
Gavin, I'm just going to pause you there because I'm almost out of time. But I've asked you a question about epidemiology, and you've not answered it at all. So let me put the question. Is that emblematic of actually exactly what you did in the pandemic?
My job wasn't to make the epidemiological assessment. My job was to make the argument for what was in the best interest of children. And ultimately, I and so many other people also believed that the best interest of children was to be in school.
Thank you, Sir Gavin.
Pleasure.
Thank you, Mr. Jacobs. Mr. Wagner, who's that way?
Of course, thank you.
Good afternoon, Sir Gavin. I act for clinically vulnerable families. I want to start by asking you about two pieces of DFE guidance. First, there was guidance published in May 2020, which said that school attendance is expected unless a child or a household is shielding or is clinically vulnerable. And that was what was said in May 2020. And as you might expect, clinically vulnerable families welcomed that guidance because it gave some flexibility for them. And then 2 months later in July 2020, the new guidance, which was for school reopening, allowed pupils not to attend school if they were self-isolating following a positive COVID-19 test, or if they had specific clinical advice from their health professional not to attend. But it left out that part that said if they're shielding or clinically vulnerable, they could not attend. Why was it that wasn't that those two pieces of guidance 2 months apart allowed for very different approaches to clinically vulnerable people, despite there still being significant health dangers to them at that time in July 2020?
That's a very interesting question, and I think where we were trying to get the balance was, the overall sense of, bringing children all back into the schooling system. And I do appreciate the advice that you highlight, but as you all know, within the school system, there is always that element of flexibility that is available at a local sort of level. So sometimes where there are very specific circumstances or such like, that is something that can be discussed and relayed with head teachers. But my recollection at the time was the sense of getting all children back into the school system at the earliest possible moment, and the sense that there was an element of flex within the system that would able to deal with any specific cases that were particularly difficult.
But that policy didn't say there should be an element of local flexibility. Wasn't it really a one-size-fits-all policy with the purpose of getting everybody back in, but at the expense of clinically vulnerable people?
I don't think it was. It was is making sure that children were prioritised, and the sense was that a key element of most important thing for them was to be back into school, and that I feel was where the thrust of the policy direction was.
But not all children are the same, are there? And there is this group of clinically vulnerable children and children who live with very clinically vulnerable adults?
You are right, absolutely. No child is the same. No individual is, no person is the same. But what head teachers do is they do have the ability to show an element of discretion where there are specific points. I think what was important in terms of the guidance and what the guidance was put there to do was to do everything that we could do to enable the reopening of schools, children to be back, but every child to get the best possible experience back into the education setting. But I think if you do, even today, if you have a specific problem with your child, whether it's sort of health related or, there's always that flexibility. It doesn't initially automatically result in some form of fine or conviction or anything else like that. That would be to misunderstand the system.
Well, on that, Professor Gillian McCluskey, who is the inquiry's education expert, gave evidence last week, said in her evidence that England took a more strict and punitive approach to school absences for clinically vulnerable children and children from clinically vulnerable families compared to other parts of the UK, which were more flexible and supportive. And in fact, that reflects the evidence that clinically vulnerable families, the group, has given from its members, many of whom kept their children off school and ended up being fined or even prosecuted. So a couple of questions arising from that. Were you aware that such a strict approach was being taken?
I was aware that we had a stricter approach to Scotland and Wales. I'm not familiar with the Northern Ireland where their position was. But it felt when the policy was devised, it seemed to be the right policy. One of the reflections in terms of the inquiry was our approach correct, or was the Welsh or Scottish approach correct? And that would certainly be something I'd be very keen to learn from and understand better if we didn't get that correct.
But aren't you saying two contradictory things here? On the one hand, you're saying we had a strict policy, but that we knew there was flex. And on the other, you're saying, yes, I was aware we deliberately had a punitive policy against parents.
I don't think I said that we had a punitive policy. I think you said we had a punitive policy.
Well, I ask you, were you aware there was a punitive policy? And you said yes.
I was aware that we had a stricter policy than where we had in Scotland and Wales. I'd assumed you were almost using journalistic language in terms of how you were sort of approaching it, maybe. But what I'm saying is that there is within the system, as you all know, a child does not get immediately, a parent does not get immediately fined if a child is away from school. There's multiple conversations with head teachers, between head teacher and parent. This is a long process, even before it gets referred on to the local authority, where any such measures are taken into account. But it gives the head teacher the opportunity to make a proper assessment of what the situation is in that family. And
sorry, I'm just going to have to jump in
course.
because I just want to get my final question, if you don't mind.
Of course.
And I would say that wasn't the experience of the clinically vulnerable families, that kind of those multi-part processes and flexibility. But just finally on remote learning. Remote learning, again, it was restricted to children who were infected with COVID-19 or had clinical advice not to attend. So if the child was clinically vulnerable, or the families were, they simply were left, and they decided for health reasons not to attend school. They were left without remote education. Was this another example of a blanket policy which came at the expense of clinically vulnerable people?
Not at all.
Thank you.
Thank you, Mr. Wagner. Lastly, it's Ms. Beattie who sits there.
Okay, of course.
I ask questions on behalf of National Disabled People's Organisations. In the first lockdown, you say that the department chose to let education settings plan their own remote education.
Yeah.
The department did not issue clear guidance on the quantity and quality of remote education, but instead in early May published descriptive information and case examples of what some schools were doing at that time. This suggested that remote education for children with special educational needs and disabilities would need to be tailored to individual needs, but it did not stipulate equal access to remote education for disabled children as a requirement. And more detailed guidance on accessible remote education was not provided in this crucial period. In practice, fewer than half of teachers surveyed for Ofsted's January 2021 report on remote education said that their school offered additional remote learning arrangements for pupils with SEND. 59% of parents of a pupil with SEND said that their child had been disengaged with remote learning, compared with 39% of parents of children without additional needs. And as late as December 2021, Ofsted again reported that for pupils with SEND, remote learning had resulted in more pronounced gaps in knowledge and skills than for their peers. Do you agree that the descriptive case examples and other resources provided by the department during the first lockdown were not sufficient to ensure that remote education was accessible to disabled children?
I do agree, and what we became aware of the level and consistency of remote education during that first lockdown wasn't anything at the level that in the discussions that we'd had with various different organisations, including representative organisations, where the very good was excellent, but there could be an awful lot of variability. That's why you'll probably sort of note through some of the evidence, sort of back in the June of 2020, we started to explore the route of direction on home education in terms of expectations. And that was the approach that we adopted later on in the year, when it became apparent that we need to use that. Sorry, I didn't mean to speak over you.
No, Mr. Gavin, you were not. Have you finished your answer?
Yeah.
Yes. I mean, you say in your statement it was your belief that we should be more assertive in our expectations around delivery of remote education. There was nothing stopping the department from being assertive in planning and drafting guidance on expectations for remote education as early as February 2020, when, as you tell us, it was flagged as part of the worst case scenario planning. And that would apply not only if all schools were being closed, but indeed if any small group, class, or even individual school or regional local area required restrictions such that students had to learn from home.
Yeah. So it's certainly one of those options that could have been looked at, yes.
Thank you, Ms. Beattie. That completes the questions we have for you, Sir Gavin. I appreciate it has been a long day and
Thank you.
several sessions for you. Thank you very much for the help that you've given to the inquiry.
Pleasure, my lady. Thank you.
Very well, I shall break now and return at 20 past.
All rise.
Yes.
My lady, may I please call Miss Jean Blair?
Good afternoon, Miss Blair. Can you see and hear me?
Yes, I can, thank you.
Okay, I'm the usher who's going to lead you through your affirmation. So could you repeat after me, please? I do solemnly,
I do solemnly,
sincerely and truly declare and affirm
clear and affirm
that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth. Thank you.
And thank you, Ms Blair. You have provided a witness statement to the inquiry dated the 9th of July 2025, and the reference we have for that is INQ 000588-049. Can you confirm, please, that the contents of that statement are true to the best of your knowledge and belief?
I can, yes.
Ms Blair, if we can quickly and briefly cover your professional background. It's right, isn't it, that you are the current Chief Operations Officer at the Scottish Qualifications Authority, the SQA, and you've been in this role since October 2014.
I am, and yes.
And in total, you've worked at the SQA for 34 years in a number of different roles. Is that also correct?
Correct.
And again, to briefly just quickly cover the roles and responsibilities of the SQA, you explain in your witness statement that the SQA is the National Qualifications Accreditation and Awarding Body in Scotland. And Ms Blair, in practice, does that mean that the SQA is responsible for delivering the annual diet of exams in Scotland from year to year?
It is, yes. Thank you.
And again, briefly, these would cover national qualifications, higher qualifications, and a range of vocational qualifications that are developed with industry partners. So, for example, quite specialist training courses.
Yes, national qualifications, higher national qualifications, vocational qualifications, and as you say, it involves a range of experts in their development.
And in terms of national and higher qualifications, would it be right to say that they are similar or broadly equivalent to English GCSEs and A-levels?
The national qualifications are broadly similar to GCSEs and the A-levels. Higher national qualifications are qualifications that are delivered mainly by colleges and involve internal assessment. They don't have exams.
Ms Blair, can you help us with how many children and young people were due to sit exams in 2020?
We certificated 129,000 learners in 2020.
Ms Blair, if we can now jump straight to the point in time where the decision to close schools and cancel exams was made. We know that the then Deputy First Minister, Mr John Swinney, informed the Chief Examiner at the SQA, Fiona Robinson, on the 18th of March 2020 that schools would close imminently, and the SQA should work on the assumption that it would not be possible to deliver the 2020 exam diet. We know that it was later announced in Scotland that schools would close from the 23rd of March, and am I right, at that point schools and colleges were asked by Mr Swinney to start working on providing estimated grades for students?
We were hopeful that we would be able to use some of our coursework when they first announced that schools would be closed. Just to explain, in Scotland, the qualifications are determined both by exams and by an external assessment of coursework. And we had hoped that some of the coursework that learners had been producing throughout the course of the year could be used to help us arrive at a judgment of their grades. So, and of course, the circumstances were overtaken by public health advice, and the decision was taken that schools would be closed and coursework would no longer be used as part of the grading in Scotland.
Ms Blair, am I right that at the 18th of March, the coursework issue was a live issue, but in the following days, that's when the decision was made that coursework marking simply cannot go ahead?
That's correct, and it had approval of our board.
And then we know on the 18th of March that it was Mr Swinney that commissioned the SQA to develop an alternative certification model, an ACM. In short, Ms Blair, is that a new model to replace exams and for the SQA to come up with a new way to award results in 2020?
That's correct, yes.
In terms of scale and risk, was this one of the biggest decisions the SQA has had to make?
It was unprecedented. Exams have run in Scotland since 1888. They ran through the First and the Second World Wars. It is the first time the exam diet has been cancelled.
And just quickly, in terms of time pressures, we know from the 18th of March 2020, we fast forward to results day, which is the 4th of August 2020. Is it right, therefore, that the SQA had around 4.5 months to come up with this new model?
That's correct, but obviously we had to make some public statements about the nature of that model, what it would contain, how we would go about delivering results for learners in a much shorter period of time. And we made our first statement about the model on the 2nd of April. So within a couple of weeks of the announcement, we were making our first statement. And just to put that into context, we were just shy of 6 weeks away from the diet running in Scotland. It had been due to start on the 27th of April.
Ms Blair, at the point at the latter stages of March, did the SQA feel that it was even possible to develop a solution that could replicate the traditional assessment conditions and the systems that you and Scotland were so used to?
We had been doing some scenario planning on the back of the COVID inquiry, but in fact, in November 2018, we'd had some systems issues and had explored the possibility of a minimum viable product involving estimates. That work was revisited as part of our discussions about the scenarios that we might encounter as the COVID pandemic was spreading. And so therefore, given the history of estimates in Scotland and also the use of alternative evidence in Scotland, we felt that we could build a credible model in the time available to us. It is the case that we did not have a contingency model in the event of the entire diet being cancelled, but we did have other contingencies, in organisational contingencies and national contingency plans in place, but none of them were about the cancellation of the full diet.
Ms Blair, if we can move now on to the topic of the development of the 2020 ACM. If we can have on screen, please, INQ 0005-88049. We can see from your statement, which is on screen, that the SQA's approach to developing the 2020 ACM was informed by 3 core principles. Is it right that these were set by Mr Swinney?
Yes, although we did help to inform those, and of course we also took them to our board. There was broad agreement about these principles when they were published. Our stakeholders also related to these core principles.
And we can see, Ms Blair, to summarise what's on screen, that the model had to ensure fairness to our learners, it had to be safe and secure while following the latest public health advice, and it had to maintain the integrity and credibility of qualifications to ensure that standards are maintained over time in the interests of learners. At the point the SQA were setting or contributing to these core principles, did you notice a potential inherent tension between the objectives of fairness to all learners and maintaining standards?
Qualifications are about standards. They set the skill, the knowledge and the competence for learners in undertaking those qualifications. Learners need to know what it is that they are working towards. Users of those qualifications need to know what learners have achieved. And there is something here about maintaining standards over time, so that learners in the past, in the present and the future are all working to a standard that is credible. So it's balancing fairness with maintaining standards. And if you don't have qualifications that are credible in the eyes of learners or users, then it undermines it undermines their worth. So there is a need to have a recognition that qualifications that in themselves are also about fairness to learners.
And Ms Blair, on that point, we know, and I'm not going to ask you in any detail why maintaining standards in ordinary times is important, but March 2020 was like no other year in that schools had closed traditional teaching had stopped, exams were cancelled, and we know that children were facing a variety of other challenges brought on by the pandemic. Was it even possible to uphold each principle in equal measures, or did some leniency had to be given between the balance to be struck between maintaining standards and allowing some grade inflation that year?
We accepted 75% of teacher estimates in Scotland. That was actually the highest in the UK. We know through our research that there is variability in estimates and reliability of estimates. So we had allowed for some variability in the estimates that we received from teachers. We knew that some learners would be sitting exams for the first time. We know that there are some low uptake courses in Scotland, and there would be some centres who would be brand new to delivering the subjects for the first time. So we took all of that into consideration in the model that we developed, and we also sought the advice of our subject experts in the work of the model, in setting the starting point distributions for our grades, and also in our awarding meetings. So although the model has been perceived as largely statistical, it was both qualitative and quantitative in its application.
Ms. Blair, just turning then to the 2020 ACM model, and I want to summarise this at a very, very high level, but in essence to set the context before I move on to ask you about other areas of decision making. Is it correct that the model worked in the following way? That centres, i.e. schools or colleges, provided teacher-assessed grades to the SQA, that they were received by the 29th of May 2020. And having identified a need for moderation that we will return to, the SQA decided to adopt a statistical approach to national moderation, in that the teacher estimates were then compared to the historic results of that particular centre or school from previous years. And then, if it was deemed necessary, moderation took place. So in other words, teacher estimated grades were changed if the estimates were outside a tolerance range. At a high level, is that how the 2020 ACM operated?
Yes, but there was also supposed to be moderation in centres and at a regional level. So we did give them historic attainment data. We did give them their estimates from previous years. We had always said that there would be some form of moderation, and we provided for some tolerances and variability in the model, but we had been clear that moderation would be needed as part of this process.
Ms. Blair, when you say you were clear that moderation was needed as part of the process, at what point did you tell teachers, schools, candidates sitting exams of how the SQA was going to moderate teacher-assessed grades?
So there were two key documents. There was a high-level message that we issued on the 2nd of April outlining that we were going to be using teacher estimates. And then on the 20th of April, we issued guidance to centres, schools, colleges, on how to use or how to provide us with estimates. We also introduced an SQA Academy course, which looked and gave them advice on how to avoid bias, discrimination, to take into account learner personal circumstances. And it was at that point we also provided information on historic attainment data and their estimate pattern from previous 2017, 2018 and 2019. And it was also discussed in the Qualifications Contingency Group, which is chaired by the Scottish Government, with a broad range of stakeholders, including the professional associations representing teachers, the Association of Directors of Education Scotland and School Leaders Scotland, we had a conversation about the need for moderation or some form of statistical moderation as part of this process.
Ms Blair, I understand the point that as part of the teacher estimated grade you provided historic data and you provided training to those teachers to try and eliminate bias. But the question was, when did you tell stakeholders, children, teachers, educational practitioners, that moderation would be based on the historic attainment of that particular centre?
I think we communicated our information to schools, but I think there is something here about what was communicated to learners and parents. We did issue guidance to learners and parents outlining what we were doing, but it was later in the process as we worked our way through how the model was going to operate.
Ms. Blair, I'm sorry to cut you off. Please continue.
It's one of the points of learning.
Ms. Blair, would you accept that the first time students and teachers were aware of how the SQA were going to moderate teacher estimated grades was after results day on the 4th of August 2020?
No, I don't accept that. We had, there is certainly something for us to reflect on in terms of the messaging that we had for learners and parents, but we were clear with the schools at the end of April what we were going to do with the estimates, that they were going to go through some form of moderation process, and in fact they had a part to play in that as well.
And we know, if we fast forward to results day, the inquiry's heard evidence from Mr Sweeney, the then Deputy First Minister. I don't intend to put his statement on screen, but he concluded that on results day, the 4th of August 2020, some of the real-life impacts of the outcomes from moderation implemented as part of the 2020 ACM became clear. If we can have on screen, please, INQ 000530329. At page 9 of that document. Ms Blair, we can see on screen this is a document from the SQA that was published on results day, and we can see at the very bottom of the document, and this is from the SQA, to conclude, we have delivered fairness to learners through a consistent, evidence-based approach to awarding, supported by an equalities impact assessment and a child's rights and wellbeing impact assessment. On reflection, do you stand by that comment that the 2020 ACM model delivered fairness?
I think the thing that separates SQA from other awarding bodies is that we had an appeals process. So we recognised that the model had some difficulties. We lived in unprecedented times. We made our best effort to come up with a model that would allow learners to be certificated. We recognised that the model had the estimates would have some variability. And so there would be some individual anomalies and individual disappointments. And the difference between our model and other models is that at stage 4, which we were not allowed to put in place following the ministerial direction of the 11th of August, that fourth stage would have allowed us at a national level to look at the individual evidence of learners, and that's what made the model more fair, because it had moved from a national exercise looking at the aggregate level, moving into the micro level, allowing us to look at individual learners that were left feeling that they had not got the grades that they deserved. So the model needs to be looked at in its entirety. It was not obviously fully implemented, and so the last part of it fell away. That said, I accept that the model could not be used again. It doesn't have public support. It was not the model that was stood up in 2021, and that has been one of the lessons that we have learned from this exercise.
Ms.
Can I
Blair,
just interrupt and say, oh, you come back. For a while, I didn't have a picture of, I did here, but I didn't up there. I just wanted to check with other people, but she's back.
Ms. Blair, you said in your answer that you recognise difficulties with the model. Can you summarise the main difficulties?
Yeah. One of the main difficulties is that we saw in 2020 and 2021 an unprecedented pattern or change in behaviour in the estimates, which we hadn't seen before and which we hadn't seen since. And the level of estimates, if I can maybe just very quickly give you some context to this. At the A grade, Scottish results are split into grades A, B, C, grade D and a no award. But at the A grade, which is the top grade in Scotland, in 2020, we saw over 40% more estimated A grades than we had in the previous year. At National 5, it was 10% overall, at Higher, 14% overall, Advanced Higher, 13%. So we had seen not just an inflation in grades, but a variability across subjects and across levels and across centres that we had not seen before. As I said, we accepted 75% of the grades put forward by teachers, but it meant that we had to do much more moderation than had been hoped or planned. And that was one of the difficulties.
Ms. Blair, in the statement from Ms. Nicola Colleen, the Children and Young People's Commissioner for Scotland, I'm going to read this out in the interests of time. She says that in relation to the 2020 ACM and the aftermath of what happened on Results Day, that this meant that children from historically poorer performing schools, often from the more deprived areas of Scotland, were more likely to have their results downgraded than those from the higher performing schools, often private. Do you accept as a general principle that that would have brought unfairness to individual learners?
I think it's worth highlighting that when we went into this exercise, all data connected with learners and the centres which they attend was taken out of the data that was put through the model. That was to ensure that it was objective and we could arrive at a position that was without fear or favour. So the historic pattern of previous centres was not played into the model, and it wasn't until as we do every year now, it wasn't until we had matched that data with the help of Scottish Government to Scottish Index of Multiple Deprivation and to other protected characteristics that we could see the impact of that model on learners in different ways.
Ms. Blair, I'm sorry to cut you off and jump in, but the question was, as a general principle, do you accept that approach would have been unfair to individual learners?
We accepted that the model was going to identify some individual anomalies, and that would mean that we would have to use our appeals process, which was individualised based on evidence from their centres, which would have been the same evidence that they would have used for their estimates, that we would have then used that in the appeals process. We did not set out to disadvantage learners from deprived backgrounds. We did not set out to do that.
Ms Blair, as I understand it, during the process of the design and the development phase of the 2020 ACM, the SQA consulted with children and young people to try to understand the impact of the model. And if I can have on screen, please, INQ 0006 12967. Ms Blair, when this appears on screen, we will see at page 1 that this is a Scottish Youth Parliament SQA Quality Impact Assessment and Alternative Certification Model Project Report from June 2020. If we could move to page 9 of the document, please. And we can see towards the very bottom of the page in the section on estimates that the feedback the SQA was receiving from children in relation to how the model was operating, or it's proposed it was operate. We can see that there's a major concern as my skills attainment was so low, which terrifies me if it's going on school averages. School attainment is improving, but we're worried. If we can turn the page, please, to page 10, we can see again towards the top of the page where a student says past estimates shouldn't be used as it totally undermines what students are doing now. It's unfair for students in poor attaining schools to be based on previous years' groups when attainment has improved dramatically in the past few years. And finally, we have a comment where it says for the SQA to look at different schools and adjust grading based on previous estimates. I wouldn't want my grade to be graded on the average of the whole school. Ms Blair, in June 2020, this unfairness was pointed out to you on a number of occasions, including by children. Why at that point didn't the SQA doing anything about it to make sure that unfairness that was built into the model didn't continue?
So as I said, we accepted 75% of the teacher estimates. We had not anticipated to do the amount of moderation that we had to do. We saw an unusual pattern of estimates coming through. And I know when we were talking about the model with other stakeholders in the qualifications contingency group on the 27th of March, there was also a concern about the quality of the estimates and about how we were going to ensure that we arrived at a credible position. We were going to have an appeals process that was going to address individual concerns.
Ms Blair, if we can now move on to the appeals process, isn't it the case that if the 2020 ACM has an inbuilt unfairness in the way it moderated teacher assessed grades based on how well a particular school had been doing in the years before 2020, unless there was a ground of appeal to get rid of the moderation, that wouldn't have helped, would it?
So the appeal was based on anybody who was sitting with a grade lower than estimated. As I've said, we accepted 75% of the teacher estimates as grades, and we were 99% accepting the grades or one grade above or one grade below. The appeals process was going to be based on that individual learner, the evidence that had been used, and by exception, if a head teacher thought there was something anomalous, then they could reach out to us, but that was by exception.
Ms Blair,
it was in unprecedented times. If we hadn't come up with a model, learners would not have been certificated. But I accept that this model does not have the support of the wider system. This is one of the things that we have learned. And in 2021, a different model was developed in cooperation with our stakeholders. It's not a model that we would use again, but it was the best model, and we believe to be the fairest model that we could come up with in the circumstances that we found ourselves in.
Ms Blair, I'm running out of time, so I want to jump now to focus on the specific impact assessment. And it's right, isn't it, that as part of the development and design of the 2020 ACM, the SQA drafted a child rights and wellbeing impact assessment. And if we can please have that on screen, that is INQ 0005303553. It's 10 pages long, and we've not got time, Ms Blair, to go into every page, but if we can please turn to page 3 of the document, and I'll just quickly summarise this. We can see that it sets out the background of what the SQA was asked to do, and at the bottom of the page, it says that the impact assessment sets out to assess the impact of the development of the ACM on children and young people, and it builds and should be read alongside the 2020 Equalities Impact Assessment. If we can then jump forward to page 7 of the document, please. Again, on this page, it reiterates that the SQA are undertaking the impact assessment, and at the bottom, it says a fuller consideration of the activity may be found in the 2020 ACM Equality Impact Assessment on the SQA website. Would you agree, Ms Blair, that in relation to this document that there's no meaningful analysis of impact or an explanation as to how the SQA were approaching the issue of impact?
As I said earlier, we didn't have a model. We were working at pace to put in place a model. And so when the decision was taken to cancel exams and to stand up a model, there was no model. And we had to embark on an iterative process to the impact assessments as we were developing the model. So at each stage of the model, we were populating and thinking about the equalities impact assessment, and we were thinking about the children's wellbeing impact assessment. I think, as I've said at the start of my statement, I wasn't as close to the work of the impact assessments as other colleagues, but my understanding was we had to do the impact assessments as an iterative process.
Ms Blair, you set out in your evidence that during the development you recognised a number of difficulties. You've outlined those to the inquiry. Isn't the whole point of a child rights wellbeing impact assessment is to set out what the impact may be, to allow decision makers to feed that into the decision making process and plan to potentially mitigate the impact on children?
I think, as I've said, we, throughout the process, tried to put in place mitigations, recognising that the model would have some difficulties around low uptake.
Ms Blair, I'm sorry to cut you off, but the question is, why hasn't that analysis found its way into the document we've just seen on screen? Because isn't that the whole purpose of the SQA drafting the document?
I don't know. I wasn't as close to the impact assessments as other work that we were doing.
Ms Blair, just to put a criticism to you, if I can have on screen, please, INQ 000649659. This is an extract from the witness statement from Miss Colleen, the Children and Young People's Commissioner for Scotland. And she explains at paragraph 130 that it was extraordinary that neither the SQA or the Scottish Government had apparently noticed the problem with the algorithm until it was pointed out. Is the real reason that the impact isn't in the impact assessments that were published on results day because the SQA didn't actually acknowledge or understand what the issue with the algorithm was until after results day?
No, I don't agree with that. I think there is, as I've said, there was a 4-stage model, and an important aspect of that, the appeals process, was not given the opportunity to run. We knew that in taking the approach that we were taking, which was the best model that we could up with in the circumstances, that we would have to allow for individual anomalies, individual disappointments, learner disappointment on the day. and our appeals process was going to be the opportunity for us to address some of those issues. So, no, I think we were going into this understanding that there would be some difficulties and had come up with a methodology to help us address some of those difficulties.
And Ms Blair, just so I can understand your evidence, is it right, therefore, that the SQA, in creating the Stage 4 appeals process, fully acknowledged that on the morning of Results Day on the 4th of August 2020, that some children, mainly those children for the lower performing schools, would be waking up disappointed, would be waking up with teacher estimates that were moderated down, and would therefore have to appeal?
There is joy and disappointment on any results day. We always have an appeals process. It has now, since 2021, been a learner direct process. We knew that there was, just as we have in every year, there will be some learners that are disappointed. The data was anonymised. We did not have centre details. We did not have candidate details, and did not set out to disadvantage children because of where they lived. That was not the model that we were working to. It was important there was an appeals process put in place, because at the macro level, which was the only model that we could come up with in the time available, we knew there would be some difficulties with a variety of reasons, like centres delivering for the first time, low uptake, all of those things. We knew that there was going to be some variability in those estimates. We weren't expecting the variability that we saw, but we then had to do some moderation of that to bring that into line, knowing that even without that moderation, there would still be some disappointments.
Ms Blair, it's my last question, because time is about to defeat me, but you've set out in your evidence the impact that the SQA recognised that this model would deliver on Results Day, and we've covered the Child Rights Wellbeing Impact Assessment, which we can see there's no analysis or evaluation in that document, and it doesn't set out what it was intended to do. On reflection, and moving forward, in the event of another pandemic or another situation whereby emergency decision-making needs to take place, how would you approach completing a child rights wellbeing impact assessment?
We put in place those impact assessments across all our services. It's an ingrained approach in SQA, and for the ACM of 2021 and subsequent, we have completed impact assessments, qualities impact assessment and child rights welfare impact assessments, and that is what we do.
Milady, I noticed the time. Those are my questions. Does Milady have any questions?
Thank you, Mr. Lee. Just one question from me, Ms. Blair. Obviously, all 4 qualifications authorities around the UK were facing a similar problem to you, and an urgent response required from you. Did the 4 authorities discuss the way forward, or did you all work totally independently?
I think my understanding is that our chief executive was involved in 4 country conversations. I think I attended one on our behalf, but yes, there was 4 country engagement.
So trying to share any ideas as to how you could develop this new scheme?
We were probably further ahead because of having a history of estimates being provided to us as an awarding body, and also working with alternative evidence.
Very grateful, Ms. Blair. Thank you very much indeed for joining us this afternoon. Thank you for your help.
Thank you. Thanks very much.
Very well. I shall rise now and return 10 o'clock tomorrow.
All rise.